A fistula is an abnormal connection between two surfaces. It has two openings, known as internal and external openings, and a hollow tract between them. A fistula in ano is an abnormal connection that most commonly extends from the back passage, also known as the anal canal, to the skin surrounding the anal canal. It can originate from the rectum as well. Rarely, it may open to other parts of the body. These include the vagina or the urinary tract. The anal canal has small glands just inside the anus. These glands can become blocked. When a blocked anal gland gets infected, it becomes an abscess. When this abscess increases in size, it may tunnel itself to the surface. This will then create a fistula, leading from the anal canal to the skin surrounding your back passage. A fistula can also occur with certain conditions. In Crohn's disease, there could be a prolonged inflammation near the back passage. Radiation therapy for cancer may also induce some changes. Rarely, injury to the anal canal, surgery, tuberculosis, cancer, and HIV infection can also cause fistulas. The anal sphincter consists of two circular muscles that surround your back passage. These help you control your bowel motions. Fistulas are classified by their relationship to the parts of the anal sphincter muscles. A fistula may go above, through, below, or in between these muscles. Depending on this relationship, a fistula may be classified as intersphincteric, transsphincteric, suprasphincteric, and extrasphincteric. The commonest type is the intersphincteric fistula. This is one of the main determinants of the treatment of a fistula. Pain in or near the back passage is one of the commonest presentations of a fistula. Pus or blood drainage from one of the openings is also common. This, however, may be intermittent. If you also have an anal abscess or an infection along with your fistula, you may notice a swelling and soreness. You may have fever as well. If the fistula communicates with the bladder, you may get frequent urinary infections. If the fistula extends towards the vagina in a female, you may experience some vaginal discharge. If your doctor suspects that you have a fistula, he will examine the back passage to look for certain features. The external opening will usually be seen in the skin surrounding the back passage. This will often discharge pus or blood. He may also examine the inside of the anal canal to look for the internal opening or the upper end of the fistula. An instrument known as a proctoscope will be used for this purpose. Many fistulas drain only intermittently, so the doctor may not identify anything during this examination if you have been symptom-free during this period. If you have an abscess, the doctor may notice redness and swelling. The area will be painful if touched. Most fistulas are diagnosed and managed based on what the doctor finds when he talks to you and examines you. Occasionally, additional studies are needed. This may be to characterize the fistula tract, identify additional tracts or openings, and to identify potential causes. An endoanal ultrasound uses a special ultrasound probe inserted to the back passage to visualize the fistula. Now, doctors can even recreate these images in 3D. Pelvic MRI scans focus on the pelvis to identify the fistula tract. If you have had several or recurrent fistulas, you may need investigations to look for an underlying disease causing the fistulas. There is no medical treatment to cure a fistula that occurs in an otherwise healthy person. Fistulas are therefore treated with surgery. Like I mentioned earlier, the pathway of the fistula is one of the main determinants of this treatment. A short fistula with minimal involvement of the anal sphincter may be treated with a fistulotomy. During this procedure, the tract is opened to connect the internal and the external openings. This creates a groove that heals from the inside out. This surgery has a long history and a good success rate. The disadvantage of this is that some muscle fibers of the anal sphincter muscle may be cut. So it's not useful for all fistulas. A seton is a thread that's inserted into the fistula. There are two main types of setons. A drainage seton is a thread that's inserted to ensure pus drains out and doesn't cause an abscess. This allows the infection and the inflammation to settle. A cutting seton is used to cut the tissue slowly so that it may heal at the same time. There are many surgical options that don't damage the sphincter muscles. Flap surgery uses healthy tissue taken from the anal canal to cover the internal opening. Ligation of the intersphincteric fistula tract, also known as the lift procedure, is a special technique where the fistula tract is divided and tied off. Newer techniques in the management of fistulas include video-assisted fistula treatment or VAFT and laser. You will be given medicine for the pain and antibiotics to prevent an infection. You should plan to stay at home for a few days, especially to allow the pain to settle. The pain will also be improved with warm baths or sitz baths. If there is a significant discharge, you can use a dressing or a pad. You must drink plenty of fluid to maintain your hydration. An appropriate stool softener may also be given to you, especially if you are constipated. Some pain medication may also cause constipation. If you feel unwell, get fever or bleeding, or if the pain worsens, you must meet your doctor. number of patients will get another fistula. This may be at the same site or a new site. The risk of getting a second fistula depends on a number of factors. The underlying condition. For example, patients with Crohn's disease get fistulas repeatedly. The type of the first fistula. If it had multiple tracts, known as a complex fistula, there is a higher chance for it to come back. Treatment methods used for the first fistula will also determine this. Like I mentioned earlier, you may need investigations to identify the nature and the cause of the fistula before treatment. If you would like to know more about this or have any questions, please leave a comment below. You could also comment on any topics you would want me to cover in the future. Thank you.